I'm recording.
All right. Okay, so I just wanted to say hello to everyone. My name is Tonya Gomes, and I'm indigenous to Guyana in South America. And I'm part of this beautiful medicine collective that we're part of today. I'm away right now, so at the TRC. I'm not in town at the TRC, so that's why I'm adding my voice to this by video camera. And I appreciate the efforts of my team that are working so hard to get me able to do this. I would like to start by acknowledging the Coast Salish people whose territory that we're on, the Burrard, the Tsleil-Waututh nations, the Skohomish, and then the Musqueam people. I'd really like to raise my hands to them and let them know that how much we appreciate being able to work here, to live here, and all the work that they've done to keep those territories safe. And they're able to have such wonderful lives here. I just wanted to talk a little bit about our, as a collective, our medicine collective, and why we're here today. And we were talking about, and from our hearts, why we're here and what we would hope to accomplish. In my mind, the medicine collective is comprised of a lot of different people, some of them here on the panel, and it's been a wonderful coming together of different nations, different cultures, and different positions in life. Our main thing of coming together is that we believe in the connection to land, and we believe in the connection to the medicines, and we believe in the connection to culture, and how that helps our people, all of our people, how that helps. And that's why we're here today. I mean, that's why we've done the work today with bringing together the medicine salves and to be able to pass that out, because we really, really, truly believe in the medicines and how good they are, and how they can help us with even the smell and the feel of them on our skin, and how they work within our bodies and our spirits. The journey of the Medicine Collective has been quite challenging and quite unique to me. We are all in all these different positions. We work in many different systems. We know that we negotiate between indigenous knowledges that some of us have, some of us are learning, some of us are remembering, and then also within the mainstream systems. We all have different, we've all worked in mainstream systems, and how we negotiate that, how we come together to do that, and then making a right relationship, and how we reconcile. It's been quite a challenge, and all of us have many, many years in doing that. Part of the other thing that we do is we know that we're weaving together multiple cultures and multiple knowledges. We're bringing all that together, and how do we do that in a way that sustains indigenous knowledge, that supports the resurgence and revitalization of indigenous knowledge, that protects indigenous knowledge, and makes it available for all peoples in ways that help us all grow and become stronger. So in that knowing and in that negotiation, we know that language is important, we know that coming together and speaking out is important, we know that community is important, and projects like this project is one way that we see that we can do that. We've been very fortunate to, because we are in an urban setting, and with many different indigenous cultures within an urban setting, we've been very fortunate that we've been able to work on the Institute of Aboriginal Health, the gardens out there, and the medicines that we've been able to grow have brought so many people together. In the course of over a year, I don't know, 1,000 people, either that might be a bit, but we were able to, the medicine brought us together so that we're able to plant the medicines, we're able to garden, we're able to bring people in and learn and put on workshops and come together and make medicines. And in that process, that coming together, that we are the medicines, that all of that is, so it's the land, it's the sunshine, Inti for me, it's Iliapa the winds, it's Pachamama, it's Mother Earth, it's the winds that blow, is all of that together, Awa, the water. And then it's the people are the medicines too. And so I want to just speak to that whole process is the most beautiful thing to me, and that's why I'm here. And I want to keep that front and center, and I hope that that's transferred to you in the medicines that you're able to pick up here today, and in the talks that you're able to be here today. I hope that's transferred, that you're able, that goodness goes out to you. I know that also, just to mention briefly, that all of us are doing work within different systems, like the health system and the education system. All of us are trying to do that work in ways that are going to support indigenous people in all sorts of different aspects. We're working on different policies about how indigenous leadership can inform policies around how services are delivered. Indigenous voice that leads any kind of curriculum, any kind of research, any kind of service delivery, that Indigenous people have self-governance and they speak and they determine what's right and how they want to go forward. So all of us I know are working towards that. And all of us, also all of us in the collective have been part of different policies, and I'll just speak for a couple for working within the health system that we've been able to do. And there'll be more information for the panel to be able to give that. But definitely the policies around Indigenous and Aboriginal First Nations self-governance, about acknowledgement of First Nations territories and peoples, and anything that systems are doing, that they have that acknowledgement built in. They acknowledge the inherent rights, they acknowledge the human rights, that they acknowledge sovereignty, that all the systems work towards facilitating access for Indigenous, Aboriginal people, First Nations people, if they want to be able to access any of their cultural practices with any of the health systems or education systems, that those systems help facilitate that. Those systems educate themselves on how to do that, and they work in respectful and collaborative relationships and reconciliating relationships with First Nations, Aboriginal people on that, how to do that. So those are some of the, again, so that acknowledgement of territory and of rights, and then about how to facilitate access. So those are the general areas, some of the policies we do. And we look at education around how do we have Indigenous voice, Aboriginal First Nations voice, providing education. And one of the examples is the medicine brochure that will be here that you guys will be able to see. And that was a beautiful little project, another project that we did where we had Aboriginal knowledge keepers, elders, wisdom keepers to come together and share what they would like to share around some of the ways that they use some of the traditional medicines from the coastal area and some interior, and then some in the Snowy Creek area. So we have people willing to share and willing to say, here's a little bit of knowledge. If you want to know more, come sit with us, come learn. And I know that in my experience within the health systems, that generosity it's gone so far, it's helped so many different things, and it's brought transformative change. At this time in our history within BC anyways, with what's going on in a lot of different systems, education system again, the health system, First Nations and Aboriginal leadership has been tremendous in making huge changes. And I'll say for the healthcare practitioners that they're reaching out, and it's that reconciliation and that learning and that responsibility, reciprocal responsibility, has been leading to better health, better healing, and I think that's such a beautiful thing to be part of. There's been again many different changes. We had a UEB ceremony at St. Paul's Hospital in Vancouver. But I think that's the first time ever across Canada we had such a ceremony within the healthcare system. And that's just one example of many of the different things. We're able to have now, there was a pipe ceremony done by a local, co-sailors person for a family, and there were 7 generations within the hospital. It was within a hospital setting. There were 7 generations within a sacred space in that hospital. And that's just another example. So I don't want to speak too much about that, but I know that each member of our collective is working in those ways, and each member of our collective are contributing and trying to live in the right relationship, and that to me what this is about. That for me, being a visitor up here in this land and all my life and being able to raise my children, that if I can contribute, if I can live my life with responsibility and giving back and sharing, then and be part of a revitalization of who all of us are, and especially who Indigenous people are, then I hope that there's something good will come of that.
Thank you.
What?